kidney and liver.
This is your next kidney liver. Wait, that's all. Oh yeah, I do have to go back to and just kind of go over the cheat sheet. All right, this is your next homework assignment. These are drugs that are kidney toxic. These are drugs that are liver toxic. The reason why it's so important to learn this list is because they will ask you interactions of drugs. And they'll say like, oh, let's say the patient is on methotrexate. Okay, they'll say your patient has rheumatoid arthritis and is currently taking methotrexate. Which other drugs, if noted on the patient's MAR, would you question? Guess what they are? Because they're both kidney toxic.
Okay.
So you will never have to memorize drug interactions if y'all can learn this sheet and the P450. Okay. So they may ask you a question like, hey, the patient, this patient has a history of hypercholesterolemia and was placed on a statin. Which of the following drugs, if the patient is also on, would you question or is on your MAR? A statin, steroid, you see what I mean? Because they're all liver. You don't want to double hit their liver. This is it. Okay. So this is your second homework. This is why, yes, this is very heavy on NCLEX because y'all have got to know what organs are affected and when to question because the resident, I'm sorry, but they're
No.
okay. So you are the, and whose job and whose responsibility is it?
Yours.
It's yours because they can order a wrong thing all day long and they have no liability because you're supposed to catch it. Okay. All right. So we're going to go through these really quickly. If a drug is kidney toxic, what do you need to draw? BUN, creatinine, GFR. If a drug is liver toxic, you're going to draw ALT, AST, ALK-phos, alkaline phosphatase, and bilirubin. Now, all of those together are called LFTs. Okay. All right. And then you need to report jaundice if they're on a liver toxic drug because that means that their billy's high, right? Yeah. Okay. This is your other homework. Y'all, we cannot move forward until y'all learn these. Okay. So I don't like doing this one next to antibiotics, but you'll have class or something on Monday. So, anyway, before y'all come in for whatever the next one is, y'all have to master these. Okay. So we've got Magic Dana and we got Bag That Ass. All right. So Magic Dana, methotrexate. What does that do? Y'all have heard of that one before, I'm sure. It works as a chemo. It also works as a immunosuppressant. All right, kidney toxic, antibiotics. All antibiotics are kidney toxic, but especially gentamicin, vancomycin. Those are the two heaviest hitters for your kidneys. Any gout drugs, because what is gout?
The uric acid.
And how is uric acid excreted? There it is. So if you're on a gout drug, it's going to excrete all that uric acid through your kidneys. IV contrast. Anytime a patient gets contrast, CT with contrast, MRI, it's kidney toxic. Chemotherapy, of course, because you're peeing out poison, right? Diuretics, that makes sense because diuretics, they pull it to the kidneys. ACE inhibitors, these end in pril. They're meant for blood pressure, but they pull all the fluid to your kidneys. They act like diuretics. Okay. NSAIDs, notoriously hard on the kidneys. Okay. That's why they cause fluid retention because they're hard on the kidneys. ARBs are the sister drug class of your ACE inhibitors. So they're for hypertension as well. So prils and sartans, those will always go together. All right, and then we're going to go over to liver where it says bag that ass. All right, so liver toxic, birth control, all of your hormones have to be metabolized through the liver. So any hormones you see, any hormonal, anything someone is taking, it's going to be liver toxic. Okay. Alcohol, y'all already knew. Gout drugs are also on the liver side because uric acid has to go to the liver where it breaks the uric acid down into urea and then sends it to the kidneys. Yeah. That's why they're on liver and kidney list. Okay. TB drugs, HIV drugs, all of your antifungals, liver toxic. Testosterone because it is a hormone. Acetaminophen, that is not an NSAID.
No, it's not.
That is Tylenol. It's not an NSAID. Okay. Then you have two of the S's for each of the S. Okay. Statins, which are for cholesterol. And then you've got your seizure drugs. Some antibiotics are liver toxic, not all of them, but some. And then steroids, because steroids are cortisol and aldosterone. Those are hormones.
So should we know the antibiotics that are liver toxic?
We're going to learn them today because we're doing antibiotics today. Okay. All right. Do we understand kidney liver? So you have 2 assignments for next time. You need to have memorized your P450 list and your kidney liver list. Got it?